Hello, everyone, and thank you for joining us today. We're excited to present the Glaucoma Preserving Your Vision with Advanced Care webinar, and that will be presented today by Dr. Scott Woolf. Dr. Woolf is a board-certified and fellowship-trained glaucoma specialist who brings to us the latest in technology and expertise in the field of glaucoma, including minimal invasive glaucoma. Today, we're going to talk about and explore the possibilities of the new technologies that are available, the diagnosis of glaucoma, and how it might affect your vision. So with that said, I'd like to introduce Dr. Scott Woolf with the Hollingshead Barrett Eye Center. Dr. Woolf, thank you for joining us today. And if I can, I'd like to turn it over to you to start the discussion.
Good to be here with you guys. So today we'll be talking a little bit more about glaucoma and ways we can preserve our vision. Our quality of life is so tied to our vision and so important to protect and preserve our vision. And glaucoma is just one of those diseases that can gradually affect our vision and limit our ability to have that high quality of life that we're seeking with our level of vision. So we'll go into a little bit of detail about some treatment options available that we have. As technology has improved, so have our treatment options. So a little bit about our practice at Hollingshead Barrett Eye Center. This is practice in the area that has been able to serve the area for over 30 years. And our office is in downtown Boise area. We specialize in vision correction, including laser vision correction, like LASIK or PRK, but also cataract surgery, which is a common need for patients as we age, as our lens gets more cloudy. Cataract surgery can help. And in many ways, glaucoma procedures are tied to cataract surgery and can be combined together in many cases. We also treat corneal conditions, and we've really been focused on bringing technology forward to our patients to provide newer technologies, bring better outcomes and safer results. And so we've been first to bring technology over time in this practice, and we will continue to do that because it's important. We have a great team of doctors and a great team of staff members to help each of our patients go through this journey. We have 3 surgeons and 3 optometrists that help, and we all specialize in procedural surgical care and aftercare. And so we just got a great team. You can trust all of these doctors, and I would trust them with all my family members because they provide great care. A little bit about me. So I did my training in Texas. That's where I grew up. And I did my training in San Antonio and El Paso, and I did training in both ophthalmology, surgical training, but also in glaucoma, including all of the medical and surgical treatments for glaucoma. And I moved to Boise about 3.5 years ago. And my wife grew up here in Idaho. And so we're just really excited to be here with our family for the last 3 to 4 years now. And so I have a family of 4 kids, and we really enjoy living in the area, and I've really enjoyed being a part of this practice. So what is glaucoma? Well, this is a group of diseases that can affect the optic nerve. So the optic nerve is the cable that connects our eye to our brain and transmits our vision to our brain, that signal of our vision. But this can become gradually affected by the pressure in our eye, which can cause more damage to that optic nerve over time. What's difficult about glaucoma is what we lose in glaucoma, the vision that is lost cannot be returned. It's irreversible vision loss. So we have to take it seriously. We have to treat it carefully, and we have to watch over it. But by lowering the eye pressure, we can lower the chance that the disease progresses or that more damage occurs to the optic nerve over time. There's lots of different types of glaucoma. The most common glaucoma is called primary open-angle glaucoma. And this is a process where the drainage of the front of the eye is open and visible when we do an exam, but where the pressure can still build. Maybe that drainage system's not working as well. The pressure can gradually rise over time, and that can lead to glaucoma. Another type of glaucoma is called angle closure glaucoma, and this is where the drainage system of the eye is more blocked or covered up, often by the iris. And so that part of the eye, the fluid can't drain well because it's more covered up or blocked. You know, think of your kitchen sink and the drainage system. And if there's dishes or plates over the drainage system, there's poor flow, poor outflow through that drain. The same kind of thing can happen in our eye. And then a third type of glaucoma is what's called normal tension glaucoma. So this is when there's gradual optic nerve damage, but the eye pressure doesn't typically read high or out of the normal range. And it can be a little bit harder to detect and a little bit harder to treat, but there are still good treatments for this condition as well. So who's at risk for glaucoma? Well, anyone can get glaucoma. It's a common disease that can happen, especially as we age. Some of these risk factors for developing glaucoma include our age, ethnicities. Certain ethnicities are at higher risk. Family history. So this is a really important one. If your family members, your parents or your siblings have glaucoma, there's a good chance that you are at higher risk of developing glaucoma over time. And so anyone with a family history should be properly examined and watched over time to ensure they don't develop glaucoma. And if they do, the treatment could be initiated. There are some other risk factors, such as prolonged steroid use is one possibility, or other injuries can lead to higher pressures in your eye. What's difficult about glaucoma as well is there's no symptoms initially. So in early stages of disease, your vision can feel totally normal. There's no pain. You can feel like you see well, but the damage can already be starting. And what can happen as it advances is you can have patchy blind spots or missing parts of your peripheral vision. And when you're functioning day to day, you may not pick up on these, and your other eye may compensate, or you may be gradually getting used to that peripheral vision that is affected. But as things advance, this is typically where the symptoms can occur, and you can have, severe vision loss, large missing areas of your peripheral vision. In the acute angle closure glaucoma, so this is more of like a sudden glaucoma attack where the eye pressure can shoot up to very high levels, causing pain, immediate blurred vision, headache, even like a halo around lights. And so that type of glaucoma is a lot less common than the gradual, slow progressing open angle glaucoma, but both are possible and can lead to symptoms if untreated. So how is glaucoma really diagnosed? This involves a lot of different testing modalities that we use, a lot of equipment to examine you, also look at the eye pressure, looking at the structures of the optic nerve. We can do scans of the optic nerve, compare them year to year. We can do peripheral vision tests where we really map out your peripheral vision and kind of track those missing or blind spots of your peripheral vision. Looking at the structures of your eye to see, is the drainage system open? How can we help treat that drainage system to ensure that the fluid in your eyes is going through the drainage system properly? And also where we check the thickness of your cornea. These are all things that we would use in our office to diagnose glaucoma. And so there's been treatments for a long time, and the traditional glaucoma treatments really involve lowering our eye pressure to prevent further optic nerve damage. So this can mean eye drops, and this can help lower the amount of fluid your eye makes or help with the drainage of the fluid. There's also laser procedures where we use a laser to stimulate your natural drainage system to allow more flow through the drainage system. And so this laser trabeculoplasty, it's called SLT for short, we'll talk more about, but that is a great treatment option and has become a first-line treatment in glaucoma. And there's also conventional surgeries where we're making a new drainage pathway, kind of improving pressure in that way for more advanced diseases. So managing glaucoma really comes down to assessing where the glaucoma stage is and tracking it over time. And when the eye pressure is out of range where we would like it, out of goal, then we can do things to adjust your eye pressure, whether it's eye drops, lasers, and surgeries or procedures. And really, to maintain a healthy lifestyle helps all diseases, so that can help. Technology has improved our ability to improve your natural drainage system inside your eye. So the natural drainage system can be treated in many ways with what we call minimally invasive glaucoma surgery. And this has improved over the years and decades that we've been using this technology. And so these types of procedures are less invasive, they have faster recoveries. Oftentimes they will be combined with cataract surgery. So anyone who has glaucoma and is getting cataract surgery, I will recommend that we include some type of minimally invasive glaucoma surgery. And there's many different types of methods to treat the drainage system to try to optimize its outflow or the drainage through that system. So here are some of those examples of the minimally invasive glaucoma surgery procedures that I do. We can actually place small stents, and these are little microscopic stents that go in the natural drainage system and can be placed either as a standalone procedure, even if you've already had cataract surgery, or it could be combined with a cataract surgery to help the natural drainage system drain that fluid better to keep your eye pressure lower. There's also different procedures where we dilate or flush out the natural drainage system with a catheter, or even make a small opening in the natural drainage system to allow more fluid to exit the eye, keeping an eye pressure lower. So these types of procedures I use on a regular basis for my patients to help minimize the amount of eye drops they may require to control their glaucoma, but also to stabilize the disease. And so these are a great addition to the technology and options we have to treat. So eye drops are not the only option, although they may be helpful for certain periods of time or as a bridge to other treatments. They're not the only option, and surgeries and procedures have become safer and higher technology is involved. We're able to address this problem in a greater way where we can have an intervention that's safe and effective and has a quick recovery to help your glaucoma. So some of these is called SLT, that's the laser procedure where we use a light to stimulate your natural drainage system. That procedure just takes a minute or two sitting at a microscope with a lens near your eye. And so it's not painful, it's quick, it has an easy recovery and can help lower your eye pressure. And so some of these are treatments, right? The minimally invasive glaucoma procedures that we do are short procedures, maybe a 10-minute procedure in the operating room where you're comfortable, you're not having pain, and we're treating that natural drainage system to improve the natural flow of the aqueous fluid inside your eye. And sometimes we use a combination of these treatments to help your pressure become more controlled. So really the questions and the next step is to ask your doctor, have a conversation about the health of your optic nerve and your eye pressure. Have regular exams are key to detect any changes to detect glaucoma early. So really half the battle with glaucoma is first identifying if it's there. And once we've identified that glaucoma is there, we can do something about it because there's a number of treatment options. The treatment options have really grown over the years. So there's many ways we can treat it. It's about finding the right option for you to treat and control your glaucoma. So that may involve, as I mentioned, eye drops is one option, but also other options that may have a great effect as well, with less reliance on the daily application of eye drops, because that daily application of eye drops is very difficult to keep a regular routine with. And so if we're using 2 or 3 medications, even for some patients, it can be difficult to maintain the regularity of that treatment. And these eye drops can sometimes cause side effects of dry eye or redness or irritation. And so, yes, they're good options, and there may be something that we recommend or your doctor recommends, but there are other treatment options that could help limit how much eye drops you need to control your eye pressure as someone who has glaucoma. And so when you're diagnosed early and we identify it early, then we have lots of treatment options to go forward. And for those that have more advanced glaucoma and they maybe tried some treatment options and need more, there are other surgeries that can be done to bypass your natural drainage system, improve the outflow of the drainage system by creating a new drain or a new filter in your eye. And so those are procedures that we do routinely for those that have maybe more advanced disease. But by catching the disease early, treating it appropriately and watching it over time, we can make adjustments along the path. So really the glaucoma diagnosis is it's a journey because it starts with diagnosis, but there is no cure to cure glaucoma in general. But there are many great treatments to control your eye pressure. Maintain a good quality of life is important as you go through this journey, and treat and maintain a good peripheral vision level where we can maintain good high quality vision. And really that's the goal, that as a glaucoma specialist, that's my goal, is to control the pressure, keep the quality of life high, offer treatments that can be helpful to control the disease. So really, we're here to help you. We're here to help your family members and your friends, and we have many treatment options that can help many patients who have glaucoma. And so we're committed to giving you the best care, and that's what we do here at Hollingshead Barrett Eye Center.
Dr. Woolf, that was excellent. Thank you very much for the presentation. We have a couple of questions that have come in. If you have just a few more minutes, maybe you could answer a couple of these questions. One question is, my mother, let me read this. My mother had glaucoma. What's the likelihood that I would have glaucoma, and how often should I have this checked?
Yeah, that's a great question. So if your immediate parent or family member, such as a parent or a sibling, that's where we're especially concerned that you may have, the probability of obtaining glaucoma as well. And so it's kind of built in your DNA, right? That at a certain age you may develop glaucoma. You may not as well. So anyone who has a direct family member should be have regular screenings where we're looking at the optic nerve, looking at the eye pressure, and really it can be something like a once a year test if everything looks normal. And as things go, if we start to develop more suspicion, sometimes we'll place you in a category of what we call a glaucoma suspect, where now we don't know that we need to treat yet, but we have some suspicions or some risk factors that we want to monitor, and family history is one of those. So that would involve, getting an exam and an optic nerve exam, looking at eye pressure, doing some tests for glaucoma, because I have many patients where I treat the mom, I treat their daughter, I treat their a brother, I treat, because this tends to run in families, and so that family risk factor is really important to look at. It doesn't mean that everyone will, but it's just something that, because you won't know anything's going on, it needs to be caught early and go through proper screening to detect it early.
Thank you. Another question. I'm currently on a number of glaucoma drops. What's the likelihood that one of these procedures could reduce my drops?
Yeah, very good question. So there's a good chance that one or a combination of these procedures can help reduce your number of drops. So if you're having side effects related to your eye drops, I recommend you talk to your doctor, whether that's us or a different doctor that you have that's managing this, because if you're having side effects like dry eye, redness, irritation, even allergy, itchiness of your eye, these regular eye drops could be causing some side effects like that. And if you tolerate them well and you can follow a regular routine, that can be something you could continue. But if you're having side effects, then it's going to lead to suboptimal control. And so these procedures can help. Oftentimes we'll look at SLT, that's the laser treatment option to help. And so that'll be a good starting point to look at. If the natural drainage system is visible and you're in that open angle glaucoma category, we can do SLT, which is a quick procedure where you're sitting at a microscope where we place a lens near your eye after a numbing drop. And in just a minute or two, that light or laser can stimulate your natural drainage system to improve the eye pressure and limit how many eye drops you need to take. And if that's not enough, then sometimes those minimally invasive glaucoma procedures can help to reduce the number of eye drops you need. So it's kind of each person's a little different. And so the first step is to let us know or let your doctor know about the side effects of the eye drops that you're having so that we could look at alternative treatment options.
That's a great lead into this next question, Dr. Woolf, which is where do you perform these procedures and what are the typical side effects?
Yeah, so these procedures are performed here at our office. We have two entrances. One is our main clinic office, and the other is for the surgical side. And so we have a surgery center with a great team of nurses and staff that will help you when you come for your procedure. The laser procedure is done without any sedation. You're just sitting up at a microscope with a numbing drop. And we do that there safely and easily. There's a very quick recovery. And some of the minimally invasive glaucoma surgery options are done with a light sedation. And so you get some medications to keep you calm and relaxed, keeps you, from having any pain or discomfort. And then that procedure can, typically range about 10 minutes for that type of procedure, 10 to 15 minutes. And then we would typically see you the day after. Recovery can be pretty quick with these as well. And oftentimes we're checking on you the day after and a week after to make sure you're healing appropriately, but it's something that can be comfortable overall.
Dr. Wolf, I think that's all the questions we have right now. If a patient wants to follow up from the webinar today, should he or she call the office, book an appointment, speak to a counselor? What would be the next logical step for a patient?
So the great next step is to give us a call and we can set up an exam and an appointment where we can meet you face to face, learn about, your eyes and what may be unique about your situation, assess your risk factors, and then come up with a good treatment plan. So we're here to help you and your family members, and so we're excited to offer these great treatments and have you be a part of the family here at Hollingshead Barrett. So we're excited to be a part of your treatment.
Dr. Wolf, thank you very much. This has been excellent. For all of you that have joined us today, thank you for joining us. Again, Dr. Wolf, thanks for your time. We really appreciate it. I think this was an excellent program.
Thank you. Appreciate you.